Okay, great. So thank you so much everyone for coming, and welcome to this month's Nursing and Midwifery Susnet event. So this event will be recorded and then shared on our website if someone wants to watch it at a later point. So we're really excited to have Ebenezer Akore Yeboah here to talk for us. So he's a registered nurse in Ghana and the UK, and a PhD candidate at Coventry University, specializing in nursing, climate change, and sustainability. So welcome. We are really honored to have you here, Ebenezer. Looking really much forward to hearing your presentation.
Thank you very much, Annie. So I have completed a PhD, so now I'm a doctor now. So I have the title. Just
Great.
to say, yes. Yeah. So you can see my screen, right?
Yeah, perfect.
Yes. Thank you very much for the opportunity and the invitation. When you send the email to invite me, you asked that I talk about a bit of my nursing and climate journey, my PhD, and the global survey that I did, a bit of international survey, where the findings of it. So I decided to then compress everything together within the short period to share with us. So titled it Nursing, Climate Change and Sustainability for our discussions today. So this is going to be my outline. There will be a little bit of introduction about me, my nursing climate journey, then also a research that I have been doing, then also a global survey, some impacts and achievements so far, a conclusion alongside with our role as nurses at the end of the day. So basically, I have got a passion for environmental issues. It has been part of my journey back in Ghana. And so with all the things about environmental protection, environmental pollution, how much can we do? And also at a point, realizing that even common malaria was one of the climatic impact that we see in the low and middle income countries, or we say in the global south. I started to think about some of these things, and I felt that there is a need for somebody within the healthcare sector to have much of a passion and desire to be an expert. So those things started to come to me. So I started a bachelor's degree in nursing back in Ghana in a university called Kwame Nkrumah University of Science and Technology. And our program runs 4 years. It's a 4-year nursing degree. In your third year, you do an undergraduate project. You have to do an empirical one, like a primary data collection. So I decided to do something with a survey on the topic healthcare waste segregation and containerization. So it was a bit of it that we found out that yes, students are exposed to clinical practices even before they are taught about some of these healthcare waste segregation. So by the time you start to teach them these things in class, they would have picked practices and attitudes in the hospital, and it is very hard for you to reverse some of these things. So those things started to initiate some conversation about curriculum revision and other things back home. So I continued to become a registered nurse in Ghana for about a year. Then I moved to the UK. But prior to that, I was a research study nurse for a global COVID vaccine trial, which was ongoing in 2021. I became a registered nurse in the UK in 2022. Then along the way, I also wrote the NCLEX exam and became a registered nurse in the US. But I am in Ghana. I am in the UK at the moment. So it's one of the things I wanted to add to my list. So to add a bit more to some of the things I've been doing in this space, I was actually invited and selected as part of the sustainability subject expert members with Florence Nightingale Foundation. It's been one of the beautiful places to be, where we actually elaborate, think about nurses, and also even being the voice of nursing when it comes to the space of sustainability. And as a result of that, I was nominated as the representative on the UK Health Alliance on Climate Change. So on UK HAC, I was the nominated representative for the subject expert group. Aside that, with my interest in this climate space and also my interest in sustainability, waste, and other things, I joined the CIWM, which is a Chartered Institute for Waste Management in the UK, as a student member, to also see what is being done in that space as well. And along the process, I did a PhD in nursing, where my focus was to look at the role of nurses in climate change and sustainable healthcare practices. And to add a bit more before I zoom into the actual work, I have also been elected as a professional nursing committee member for the Royal College of Nursing, West Midlands region, and also I am part of the International Scientific Advisory Panel for the RCN with their research element. I am also a member of Sigma Nursing, letting you know about this. So this is a little bit about my journey so far. So to bring you into the space we find ourselves, climate change, we know that it is a problem to humanity, and we see the impact thereof happening to everybody. No one is exempted, but then there is a little bit that we will say that some nations actually suffer the most. And we would say that when you divide the globe into two, those in the global south are actually the ones who suffer the most. And with all the scientific analysis and other things, we tend to realize that we are within a particular geological time on this Earth lifestyle or geological season that we call the Anthropocene epoch. That is a time which human activities are having an actual impact on these climate emissions and climate change. And through scientific consensus with the IPCC and the United Nations, it has been agreed that human activities are actually the major cause of climate change. The impact is massive. Now, you see, people are being displaced from their homes. I decided to show this image of a little boy saying to the rest of the world that if we could prepare a place for them to stay, this tells you what some of these climatic impact is doing to the livelihood of other people, and they're being displaced. And when it comes to climate change impact on the health of many individuals, it is so massive. We could talk of all the systems in our human body it would have an impact on. It would have impact on our cardiovascular system, our respiratory system. People struggle even with your digestive, having cholera, people having mental health disorders or mental health problems because of the impact of some of these climate change, because people are displaced from their homes most of the time. And I did also mention about malaria at the start of my introduction, where it is one of the vector-borne diseases massively also being introduced, or let me say, being supported by this climatic event. So these are some of the little impacts that I would want to talk about. But in all these things, like I stated, human activities are the major cause of climate change. So all sectors across the world, whether it is aviation, engineering, whatever sector it is, housing, all these sectors contribute to these climate events, and in terms of the emissions that we talk about. And the healthcare sector is not exempted. The healthcare sector contributes approximately 5.2% of the total global greenhouse emissions. And the NHS in the UK context contributes approximately 40% when it comes to the public sector emission. And per analysis of a recent article I came across, NHS emissions alone is equivalent to a whole country, Croatia's emission. This tells you the massive footprint that we do have, but that is also, this analysis were done a few years back. So hopefully at this time, looking at all the NHS activities, their green plan and other things, probably there's been a bit of improvement in that arena. And when you take the healthcare sector, nursing, we have got a massive proportion when it comes to the workforce. We are the largest. So we are also using a lot of product. We are also being part of commissioning of even project within healthcare sector. We are taking decisions. We are being part of policy makers. So it is very good that we think about some of the footprints that the healthcare sector actually produces or do have, and think about our profession, how much that we can do. So it is at this background or on the basis of all these things that I decided to do a research to actually explore the potential role and scalable impact that nurses could make in relation to climate change and environmental sustainability. So with that, my PhD was in phases. There was a phase 1, a phase 2, and a phase 3. So the phase 1 actually did a systematic literature review. The protocol and the paper itself have been published. As I speak with you now, it has, within a short space of a year or so, it has got about 50 citations so far. And with this particular phase, it announced something. I moved on to with the findings. I will talk about that in the next slide. So from phase 1, I move on to do a phase 2, which was a multi-country survey that normally I term as a global survey, but then it is an international multi-country survey, where I had over 500 participants from 56 different countries. The findings in the survey prompted that there is a bit of leadership gap. So then it informed my next phase, which was a qualitative interview among stakeholders within the NHS and UK at large. And so with the phase 1, which was a systematic literature review, I had 5 main themes coming out of it, and from the 41 included papers. One of the striking chord was that some papers, especially there were 2 papers, one from Canada and one from China, stating that nurses do not see the connection between their nursing practice, carbon footprint, and climate change. So it started to strike a chord. How is that so? How is it not something that I would need to explore? That is one of the findings that actually serve as a justification. In this systematic literature review, some of the things that I also noticed was that people who were even aware of climatic footprint or climatic change impact within the healthcare sector actually got to know about a lot of these things through the media. And so a question was coming out: what is the healthcare sector? What is the healthcare institution, educational institutions also doing about these? How best can we leverage with the availability of the media to actually also inform our people? And one of the surprising things is that people could see that their link with nursing and climate change was related to the care they provide to climate sufferers or people who get issues or get impact through climate events. But then they were not seeing that their practice has got any correlation with that, as those papers responded or talked about. In view of that, I did a global survey to actually look into the knowledge, the perception, the attitudes with climate change, with climate policies, and some of the barriers. It was a massive data. And so at the end of the day, 543 participants from 56 different countries answered this particular survey within the space of 3 to 4 months. And a lot of the majority actually came from Europe, because I had over 175 participants from 18 countries within Europe. And also it was followed by about 144 from 15 countries in Africa, then Asia, then North America had about 7 countries representing, then South America. And obviously with Australasia, that bit is a bit limited, because we have only got Australia and New Zealand in that area. So those are some of the findings that came from this particular survey. A little bit that I want to talk about is this. So when those 2 initial papers reported that nurses were not seeing the link, in the survey I did, approximately 82% of the individuals agree that there is a link between their nursing practice and climate change. So it was telling us something, that there is a bit of a shift, there is a bit of knowledge update along the process. But surprisingly, nearly 75% of these participants were not aware of what net zero healthcare is about, which was a bit worrying. So if people are not aware of these net zero healthcare, net zero policies, how would they start to implement some of these things? That is not to say that awareness lead to practice, but then awareness in some of these spaces have got a little bit of a correlation along the way. Then also, one of the things that was also striking to me was that 90% of the participants said they've had no training on climate change or nursing. Nobody has mentioned this. So this was actually also telling us of the much of a gap that we tend to see within the space of climate knowledge in nursing and healthcare. There were many other findings, but then I decided to talk about these few ones. The global survey has been submitted for publication. It has been accepted. And at the moment, it is under print, or let me say in press, nearly coming out very soon. So barriers that I noted from this particular study was inadequate policy implementation. So a lot of the people were talking about these policy implementation being inadequate, workload, unnecessary procurement. Some of these things were coming up from the survey. So the inadequate policy implementation coupled with other findings then drew an attention for me to then go into leadership to see, because it is these leaders that we have in healthcare, in the nursing environment, that is able to help with some of these policies and let people, those on the shop floor or those working with patient or having patient contact, to know about some of these things. So it became a justification for me. I did a stakeholders interview, and with this 15 stakeholders interview, 5 main teams came out. So a manuscript is being prepared on that at the moment. And at the end of the day, the findings of the survey and the qualitative interview phases led to me developing an educational course content. So as I speak with you, I've got a course content regarding the findings that I have, which is drafted. It's not been tried or been implemented in any phase yet. And also along the process, I was able to develop a framework. So I've just shown you a bit of a picture of what the framework looks like, a nurse-led sustainable healthcare transformation framework. That we have a foundation construct with some barriers and some catalytic mechanism, and the outcome, which is looking to have an utopian vision realization, which more of it will come in the future to talk about. So this is what has been my whole study of a PhD about. So implication-wise, we need nursing leadership in climate change and sustainable healthcare. We need the inclusion of sustainability into curriculum. I do know that there is a bit of work ongoing with our regulatory bodies like the NMC and also RCN having their part also playing, a very good one, which is ongoing. So in the future, we will tend to see a big voice in this particular space as well. And also, if we could have some carbon literacy trainings and innovations, some of these things will help. I am also aware that there is a bit of carbon literacy training, but it is also optional, which is in the system. But if it could become part and parcel of maybe inductions within healthcare sector, it will be very good for us to think of planetary healthcare and other things. So recommendation-wise is that if we could implement, if not mandatory or not part of the nursing curriculum, an optional sustainability placement. If we are able to have some of these things where students get to expose themselves to about 2 weeks of a sustainable project, it will start to share or bring people's idea in some of these spaces. And these things will also need the help of university institutions to do some of these particular placement alongside the NHS as well. And we tying leadership KPIs to sustainability could also have an impact. And I do know that in a space, most of the time, sustainability teams and the infection prevention teams will not meet at one point. There will be a bit of clashes along the ways. But if we are able to be coming together within institutions to develop standards together, I do believe that we'll have a smooth course in helping to let sustainable healthcare, net zero healthcare be part of us. So as nurses, our role is massive. We are a global force. This is a known fact. All of us on the call are aware of this. We are the largest section of the healthcare workforce, about 30 million with what is existing in the global workforce. We are largest. Over the past years, we have been the most trusted profession 22nd time in a row with a particular survey being done in the US. This tells you that we've got a voice. People are able to even listen to it. We could have impact in our patient and among our colleagues as well. And we are also quite close because there are nurses within nations which are really suffering. You go to some remote areas, you'll not find a medical profession there. You find a nursing member who is leading a team. They're taking care of people who are so vulnerable, marginalized, and underserved in some communities and nations. So because of that, we can use our presence to address some of these things. Areas of impact, we can think of clinical assessment, clinical decisions, thinking of reusable product, which is also on the go. And I must mention that I've got some nursing colleagues, even within Birmingham, who have started some circular economy with shower gel, which is also something being adopted, a very good one. We can all start something gradually. And also quality improvement project, responsible triaging and cannulation. I would want to mention that at Trust That Working has been able to reduce massive amount of unnecessary blood clotting tests that they do take. All these things being led with nurses' input and other things. Having leadership positions, having institutions like the RCNs helping us to have some of these roles within the healthcare sector, and career progression could be a pathway that we would be able to address some of these things and help people to have a career in that. So at this moment, coming to the very end of the presentation, I would want to also talk a bit about the things that I have done within a space of 3.5 years with this particular PhD. I have attended at least 17 conferences around the globe. I was in the US just last October to talk about my research and also some findings as well, where I had I won some funding grant from the National Sustainability Society to attend some of these things. I've also been to International Council of Nurses Congress in Finland to talk about this particular project. A lot of conferences across Royal College of Nursing, International Nursing Conferences in Manchester, in Newcastle, in Exeter. Over these years, I've been there to present my findings as well. I've done podcast interviews as well and written about 4 blogs regarding the work I'm doing in sustainability and climate change. Some of these things to encourage all of us. And I've also won an ECRC impact training where I was taken to the UK Parliament to be trained on some interparliamentary and industrial workshop, which all talks about the work that I am delivering. So when it comes to this PhD, 2 publications are out. There is one in print and there is another coming. And also I am to share that the survey that I developed for this particular studies has been adopted by midwifery academics in Australia. As I speak with you, there is an ongoing climate survey, a global ongoing climate survey in Australia among midwives, which they are using. With my last update, we have about participants from about 20 countries from the update preliminary findings from the ongoing global midwifery climate survey. And also I have been invited and I have contributing to a book chapter on planetary healthcare in Canada as well. currently, I just got a role as a nursing lecturer at Birmingham Newman University currently. So to talk more about some of these things, those were some of the impact, and to talk of achievement. In the year 2023, 2024, I think I became the Early Career Researcher of the Year by the Royal College of Nursing. That was a recognition I got, and the work got recognized and being featured on BBC. Later on, got invitation from the BBC to also speak about making the NHS green. It is some of the achievements. I was at the RCN Congress in Wales, where I speak on a Congress item, how to achieve a greener healthcare system. Now, to talk about this particular, a short video of that, about 2 minutes of that, have got over 22,000 impressions on LinkedIn as I speak with you. Later on, got nominated for a Student Nursing Times Award 2025, and later got shortlisted, where I became a first runner-up in as Student of the Year Black Healthcare Award in the UK as well. It did not end there. The work that I was doing in climate change in this particular space, planetary health, it got mentioned among MPs in the UK Parliament when there were some a discourse between two UK Parliament, just to show you some of the impact and how our works are going there. So if we are to move on with the little we are doing in this space, people will recognize it. I've contributed a piece to the Nursing Times magazine, just to show you a picture of me in my uniform as a nurse when I started earlier on. And also when I got elected as a PNC member for West Midlands, showing you an image of it. So there are many other things to talk about. This is my review at this journal, then a bit of the protocol, a blog at Evidence-Based Nursing Journal, being also a reviewer for some other things, being a chair at RCN Congress. And I think along the years, Florence Nightingale was celebrating some 90 years, and they selected 90 nurses across their space in the UK, and I was one of the people to be made publicly as part of it. So I talked about my global survey. This is a decision on the survey, just to show you evidence that it has been accepted and it is in print as we speak at the moment. Some awards earlier on with my Coventry. So it was also not only global, locally too, in my Coventry University as a postgraduate researcher of the year finalist, to share with that. So with all these things, I would want to thank my participants, my survey participants, respondents. I also want to thank my individuals who were part of the interviews that I did. Had they not given me this particular data, I wouldn't be in a space to share on this particular platform. So whoever took part to make this particular project and PhD journey a success, I want to say a very big thank you to everyone. I have not mentioned everybody's name. Nursing Now Challenge actually also hosted it, and also NHS England, they've got a nursing and midwifery sustainability network. I also remember I shared this particular survey on the Center of Sustainable Healthcare, their nursing and midwifery forum as well. So there have been so many of these, and I want to thank my supervisory team, Professor Rosie Nipsey, who is in Coventry at the moment, Professor Amanda Adegboye in Royal College of Nursing. I have Professor Om Kemi, who is at the University of Lincoln, and Dr. Laura at King's College London. So thank you very much. This is a few bit of references about the work I did, and the end of my presentation. Thank you.
Wow, thank you so much, Ebenezer. I think you've probably seen all the hearts and all the claps coming up on the screen, and yeah, all the love that I sent to you. I think there's been put a few questions in and comments in the chat here as well. One of them is your lecture position teaching on sustainability in healthcare?
Unfortunately, no. It's in adult nursing. I would
Oh,
wish there would be a role like that where I could put some of these things across. But
I think you kind of have to sneak it in, Ebenezer.
yeah, yeah, that's the hope. I want to find a way of bringing it in that it could be something you can teach also in the nation.
I
Yeah,
think you can sneak it in with whatever subject you teach, and it will be relevant, I
yeah,
reckon. I think you'll become very adept
yeah. Oh yes, feel very privileged to play a small part in your research. Yes, I remember Lucy Brown. Oh yes, I remember her. She did a massive part of it in the initial days with Florence Nightingale when I wanted to share it. She was there with me. Thank you very much. Yeah.
that's good. Is there any other questions from anyone else? Anna.
First of all, congratulations. I don't think you need to hear it. I think you know you did very well there with your PhD and all the awards you've gotten for it. I was just wondering, you spoke about you developed some like, was it teaching content or like lessons?
Yeah.
Is that already available somewhere or are you still working on it?
So at the moment it is with me. It's not been made publicly available. Would want to trial it with universities and where I am before I can share it outside. But if there is a need for me to also share with you along the way, we could talk about it. Yeah.
Are you using it then for teaching undergrad nursing students in adult nursing or
Yeah,
as a
for now, I
Mhm.
started the road just this month, last week. So I'm here to find ways to sneak some of these things into the models that I will be delivering. So I'm yet to, yeah.
Fingers crossed that it works out.
Okay, I think Rose says, thank you for the presentation. She's got another meeting. Yeah.
Mhm.
I just had a question about your, so you mentioned the survey that is carried out in Australia amongst midwives.
Yeah.
And it just sounds really interesting. Is it then assessing what you also did on a large scale internationally? Is it kind of the similar question? So is it something that, for example, could be adapted to all areas of nursing that would
Yeah.
be a possible tool for, I don't know, each trust, for example, to or area or expertise to ask the nurses about how they are, meeting or adapting to sustainable practices and how they're thinking about it, just to also raise awareness.
So it's also on a global level. It's not just within Australia. I mentioned Australia because the midwifery academics are from Australia, those who approached me. And I think we are about 6 people on it. But as we speak, with the results coming in or the response coming in, we have got about 20 different countries participants on it. So we only tweaked a few bits of the tool I developed to suit the midwifery language or the midwifery space. That is what we did with that. So it's more of the tool or the survey questions is easily adaptable in all other spaces. You can just use it because it assesses some of these climate awareness knowledge. It assesses awareness of climate policies within the system, our perceptions around some of these things, and it raises people's awareness. I remember I got a lot of people because I also posted on WHO platform and people were sending email back that I am making them think about their practices while they answer the survey. So is that bit of yeah that I can say.
Yeah, great. Thank you. Angela, are you on mute?
Yeah, sorry. It was only to kind of flag up Lucy's post in the chat there about the Sustainable Innovation Nurses and Midwives course that we run at CSH that Anna kind of leads. And I think Lucy's asking, would you be happy to share that with your survey participants? It's free kind of access to global training, so it's not just a UK-based thing.
Okay, that would be great. That would be great. And I also want to say a very big thank you to the Center of Sustainable Healthcare, because I did about 4 courses with them on carbon footprinting, but it was not free though. So carbon footprinting, teaching soft skill, it was an eye-opening. Yes, it made me think a very different, because mine was more education, research focused. But when I started to think about how these QI project and things, it's quite a beautiful thing that I want to also say a big thank you to them. That I'm hoping that I could also replicate the knowledge they gave me in those times. Yeah.
Thank you. I think it's really just impressive, like all the work that you've done, and also being able to scale it so much. And I think it's a real it brings a lot of encouragement, and also it's kind of making it with a survey or a short questionnaire. It makes it actually quite easy to encourage I mean, just colleagues, or just to do something like quick, just to kind of raise the awareness. And sometimes we think that we have to do so much to try to make that change, or do something, go out and talk about these issues and to raise the profile. But I think many do care for the climate change, but don't necessarily want to take that space to raise their voice. But through our questionnaire, it's such a good way of doing it.
Yeah. It's not an easy thing to for us in this space though, because there is a lot of climate critics, and you see some of these also actions that we'll take. It doesn't give us an impact, or let me say, we don't see the results in a very short term. It's like a long-term thing. So people are quite looking for an instant fix in many situations. So if you try to convince them, it's not easy. Sometimes it's easy for me in educating, easy for me in researching, but when you get to practice, looking at the stress, what you need to do, patient safety, no time for you to even talk about some of these things. And looking at the state you find your colleagues, you don't even want to let them feel a bit of some of these things. So it's a hard space, but I will keep it going. We will not let anything discourage us, because some people have to step in, be in that gap to keep others alongside.
Yeah, thank you. Is there anyone else who has any questions at all? No. Yeah. Peter says, thank you for your presentation and talking about your journey. As a student nurse currently, I found this really inspiring. So that's really nice. Yeah. I guess we can end the session. We're a bit early, but it's been a real pleasure to have you, Ebenezer, and it's been really inspiring.
All right.
Mm.
Thank you very much.
Yeah. Thank you so much.
All right.